morning and welcome back to the chat on Newsday Amarillo and News Channel 10-2. This morning we're joined by Dr. Amanda L. Graham. She's Chief of Innovations at Truth Initiative. She wants to talk about stopping smoking, something we all need to do. Chuck, you're the one we're targeting this morning. Go ahead and ask the doctor your question.
Always picking on me. What's the issue with adult smoking?
Well, you're not alone. There are over 50 million people in this country still using tobacco products. Smoking is the leading cause of preventable death and disease in this country, and kills over 480,000 people every year. That's year after year. So there are lots of good reasons to quit.
Well, how can an employer help you quit, doctor? What are job sites? What are people in the workplace doing? I know most of them say you can't smoke in the building. I can remember the days when you could smoke at your desk.
Right.
So the first step is to have a good, consistent tobacco-free policy at the workplace. And then it's important to get a proven, effective treatment program into the hands of employees. And this is good business also. We know that it helps the company bottom line. We run a program at Truth Initiative for employers and health plans called X Program. And we work closely with employers and with health plans to make sure that their employees are using the program and that they're seeing the kinds of results that they're looking for.
Is vaping really big a problem as we keep hearing about among our young? I keep hearing it pops up and then it goes away. You don't hear anything about it. And then next thing you know, there's campaigns against Juul. And is the vape problem a serious issue with our young?
Absolutely. We've seen a slow shift in vaping rates among young people, but there's still more than 2 million kids vaping, which means they're using nicotine products. Nicotine is a highly addictive drug. And in the developing brain, which happens up until the mid-20s, it can really set the stage for later addiction. So no young person should use any form of nicotine.
What are some of the biggest struggles with quitting? What are the biggest challenges?
The biggest challenge is nicotine and the addictiveness of it. I think, I'll add to that. A lot of times people have tried to quit multiple times. They feel demoralized. They feel a lot of shame. And a lot of people start to think, well, it's just not for me. I'm just not a person who's going to be able to quit. Those are common misconceptions, and that's really the addiction talking. The key thing is to get connected with a supportive program to learn how to quit. This isn't something we're born knowing how to do, and to use medication that can make the quitting process much more comfortable.
Doctor, real quickly before we let you out of here, how can they connect and find a program that works for them? What are some resources we can go to?
Thank you. Yep, we have really great, proven, effective programs that millions of people are using across this country. You can learn more about them on our website, which is truthinitiative.org/quitting.
Dr. Amanda L. Graham, Chief of Innovations of the Truth Initiative. This segment has been brought to you by the Truth Initiative and an attempt to end smoking in our society. Doctor, have a great holiday. Thank you for your time this morning.
Thank you, you as well. Happy holidays.
Happy holidays.